Hey, I'm Josh Popek here at Brock Insurance. Today, we're going to be talking about Medicare Advantage versus Medicare Supplement, and really just to kind of start things off, the top 3 reasons to consider Medicare Supplements over Medicare Advantage. Now, we're going to break these down one at a time, very slow. But number one, we're going to take a look at, and I'm sure a lot of you guys have heard about this, if you've done any kind of research whatsoever on any type of Medicare, prior authorization. That is one of the biggest things that I hear about on a day-to-day basis. I still work with this kind of stuff every single day, and if I'm talking to a client who has original Medicare with a Medicare supplement, or even someone that may still have Medicare Advantage, this is going to be my number one complaint. Now, what prior authorization is, it's really just the insurance company, especially whenever it comes to Medicare Advantage, they're just wanting a little bit more documentation. Now, what I mean by documentation, they're wanting more paperwork from the doctor's office that is saying, hey, we need this right here to prove, really just to say you actually need this service. If you had a Medicare supplement, you do not have to worry about prior authorization whatsoever. Your doctor, he orders the service to be done and it gets taken care of very simply. Now, moving on to number 2, networks. This is going to be the second most talked about issue whenever I'm talking to a Medicare beneficiary. You work all your life, you have your health insurance, you're already used to networks. Now, come Medicare age, whenever you're Medicare eligible, you don't want to have to deal with this. If I'm going to be completely honest with you, you're entering that golden age to where you can get a Medicare supplement. You do not have to worry about medical networks. As long as your doctor accepts original Medicare, you are completely fine to go and see that doctor. If your doctor does not accept a Medicare Advantage plan, if they're not network with it, a couple of different things can happen. It can delay your care, but the number 2, you're going to be footing a lot of the medical bill. Once you're on a limited income, whether you're drawing Social Security, you may be drawn from a retirement account. I know very well you do not want to have to foot a majority of your medical bill the older that you get. It can become very unpleasant the older that you do get. Then also another thing on networks, if your doctor were accepting a Medicare Advantage plan at that point in time, one thing that we have noticed here over the past couple of years, there have been more and more Medicare Advantage plans that have either left the market altogether or the doctor no longer accepts that health insurance plan. What does that mean for you? Your doctor's not accepting your health insurance anymore. You go back to having to foot a lot of the bill at that point in time. Then moving on to number 3, large copays. Now, I got this underlined 3 times. There are some very large copayments whenever it comes to a Medicare Advantage plan. Whether you're taking a look at a specialty copay, sometimes that can range anywhere from $40 all the way up to $65. If you take a look at an outpatient surgery, on average, from what we're seeing on outpatient surgeries right now is around a $450 copay. Physical therapy, that's going to fall under a specialist copay. Sometimes it could be higher than a specialist copay. Some of these copays are completely avoidable. More copays that come to my mind, an inpatient hospital stay. I tell my clients all the time, you can ride down the road and take a look at the local hospital, and it is always going to be full. What that means for somebody, let's just say if we have a Medicare Advantage plan, we get put in the hospital, we're in there for 7 days, you're potentially looking at being out of pocket nearly $3,500. A lot of the Medicare beneficiaries I talk to, they may draw that in a month's worth of cash gone just over a course of a week. I don't want any of my clients to be in that situation. Now, there are ways to where you can fix that. You could take a look at potentially adding a hospital protection plan or a hospital indemnity plan. I wouldn't recommend having a Medicare Advantage plan without that. But still, in my opinion, you're entering the golden age for your health insurance. You have the choice to go Medicare Supplement or Medicare Advantage. What's so cool about Medicare Supplements whenever you are turning 65, they don't ask any health questions. They don't take a look at any of your medical records. They do not care what medications you're taking. You will get approved for that coverage. If you opt into a Medicare Advantage plan and you wait too long and you decide, hey, here we are 2 or 3 years later, these copays are starting to get on my nerves, These prior authorizations, they're starting to become an every month thing. These networks, my doctor, he doesn't accept that plan anymore. It's too much of a headache. Whenever you can sign up for a Medicare supplement 6 months before you turn 65, 6 months after you turn 65, you're right there at that golden age to make a very, very, some would say, I don't want to say a difficult decision, but a very, very big decision on what your Medicare is going to look like for the foreseeable future. This is a one-time only period. You got one choice. Make sure you're making the best one for you at the end of the day. But to avoid all these right here, and we'll just go back through here, to avoid any type of prior authorization, go with a Medicare supplement. To avoid any kind of networks, go with a Medicare supplement. To avoid any type of large copays, go with a Medicare supplement. Once again, my name is Josh. I'm with Brock Partners. Thank you so much. Have a great rest of your day.